The VHHA says this problem has been around since before the pandemic began, but earlier this year, about 20% of Virginia hospitals were deemed critically understaffed.
We are down, I would say, several thousand hospital staff members in Virginia. There are openings at hospitals across the Commonwealth.
Staffing shortages in hospitals now leading to longer wait times and higher occupancy rates. Health.gov data showing Bon Secours St. Francis Hospital at about 94% of its total occupancy the week of July 15th. Bon Secours Memorial Regional showing about the same. So why is this happening if staffing shortages are nothing new?
Data anywhere you look, but we'll cite the Bureau of Labor Statistics. Their data has shown that there is something of a bottleneck that is forming. You have more people of a particular age cohort, again, the baby boomers, who are aging into retirement. Those folks who tend to be older tend to have a higher utilization, have sometimes greater medical needs, and therefore higher utilization of healthcare services.
Julian Walker with VHHA says increased wait times and higher occupancy rates can be traced back to staffing shortages in psychiatric facilities.
When those patients need to go to a state psychiatric hospital, if the state psychiatric hospital can't accommodate them, what happens to those patients? Then they're sitting in the emergency department for hours or days on end, while they're waiting for a transfer to an appropriate inpatient facility.
Bon Secours now introducing a new program called Flex Nursing to recruit nursing staff and give them more flexibility.
Our own nurses that are in our flexible programs in our market or our facilities have been trained all the same way. So they have the Bon Secours training, and they go through orientation and training just like any other nurse would that enters our system. And what we have found is actual travelers that may not be affiliated with Bon Secours Mercy Health, but are travelers, they are actually converting to some of these programs now.
These problems, he says, now causing public safety concerns.
When a sheriff's deputy or a police officer, is involved in responding to a mental health call, and then they have to transport the patient to the hospital, and then they're waiting to transport that patient to the facility where they're going to get transferred to for inpatient care, however long that police officer or deputy is assigned to that patient, that's hours that person is not out patrolling the streets.
Bon Secours says they are trying to recruit internationally too. They are planning on having a job fair in September to recruit more nurses.